As you may be aware, Australia has the highest rate of skin cancer in the world, and up to 50% of Australians will get skin cancer sometime during their lives. Often patients go to their general practitioners with skin lesions that they're concerned about, but actually what's most common is that the lesion that people are most concerned about is actually not the cancerous lesion, and cancerous lesions are found in other parts of the body. So that's why it's important that general practitioners and skin cancer doctors take the time to do comprehensive skin cancer checks on their patients so they don't miss lesions that are hidden on the body that patients don't know about. So also patients don't really know what to look out for. So it's important that when you do a skin check, you advise patients what to watch out for. Also sun protection activities, maybe even a bit about vitamin D, and so that people have a comprehensive sun protection program. It's important to be systematic when you're doing a skin check. So in other words, I tend to do exactly the same sequence whenever I do a skin check, and it's also important to not miss any parts of the body. As I said, most people don't know what to watch out for. I mean, as I'm doing a skin check, I'm talking to people about sun protection. I'm talking to them about what sort of lesions to watch out for, if there's anything that's bleeding or ulcerating, anything that's dark or irregular, funny shapes, funny colors. So while you're doing the skin check, it's important that you're educating the patient at the same time, as well as detecting skin lesions. At the same time, I tell people how often they need to come and have their skin checked, and explain to them if they need any procedures done at that time. It's very important that healthcare professionals in Australia understand the diagnosis and management of skin cancer at a GP level. It's not very difficult to perform basic skin cancer checks and basic skin cancer procedures, use topical therapies in a basic fashion, and understand when to refer patients with skin cancer to appropriate resources. It's vital that GPs in Australia understand that, and at the end of the session, GPs will understand how and when to refer skin cancer patients. I think it's important that general practitioners, if they do skin checks, have a dermatoscope. There's various types of dermatoscopes available, and we'll go through the various types of dermatoscopes during the presentation, and how to buy them, where to buy them. It's also important to know how to use the dermatoscope, what sort of lesions to watch out for. There's certain algorithms and systems for examining the skin using a dermatoscope, what sort of features to identify to determine if it's benign or malignant. Often it's only really important when you're starting off to determine whether the lesions are benign or malignant. You probably don't really need to make a diagnosis straight off. So the important thing is to know really when to leave something, when to biopsy it, when to refer it. And we'll go through that during the presentation.